In the early 19th century, nursing was primarily regarded as a despised domestic service, a position for those women who could earn a living no other way. Formal education of women was unheard of, and most definitely there was little in nursing, which was seen to require formal education or training. The second half of the 19th century brought developments, which were to challenge this view and influence change in the practice and status of nursing. Firstly, there was an unprecedented growth in knowledge, which affected the practice of medicine. Advances which demanded more time than a doctor could realistically afford each patient. These advances also required changes in hospital practice and a demand for more nurses. But what was nursing? Many more nurses were needed, but nurses educated in a different way and quality of nursing. Previously, no real connection with medicine had existed, but a new relationship was evolving. The turn of the century saw an era characterized by growth, immigration, and industrialization, an era also characterized by poverty, illness, and death. Disease followed the influx of undernourished immigrants who were forced to travel and live in overcrowded, unsanitary conditions. With limited sanatorium facilities and the fear of hospitals, the ill were often cared for in tents behind their homes. Patients in lay hospitals were shown little concern. These were years of illness and death from causes which are now preventable. Diphtheria, cholera, typhoid, and tuberculosis all took their toll. Pre- and postnatal care were scarce, infant and maternal mortality high. In response, there was an awakening of public concern. Municipal governments were appointing full-time medical officers of health. Health care for all, not just the affluent, was the goal. Attention was directed towards the weakest groups in society, including the mentally ill, the disabled, and the young. 96 hospitals were established in Ontario between the years 1880 and 1914. 12 were in Toronto. Existing hospitals underwent renovations and additions. With the dawning of the 20th century came a change in the status of women. Once denied education for professional work, they were now graduating from high schools and universities and involving themselves in the problems of the times. And nurses, affected by this change, became more aware of the potential of their role. They recognized that if nursing was to meet the needs of society, it must be elevated to the status of an educated profession. Hospital boards, doctors, and nurses all agreed that the establishment of more training schools was the first step in providing more nurses. Unlike medical students, student nurses receiving free education were bound by apprenticeship, and teaching was not a priority. Placed immediately on wards working 12-hour shifts, often of 6 weeks' duration, there was little time to be taught. Service was a great deal of housekeeping, domestic work, rather than nursing. Teachers were ill-qualified or not available. Doctors were too busy to give lectures. Lack of planning and coordination led to an ill-arranged, sometimes non-existent program of study. Yet after a designated period of time, the hospitals granted a diploma to the graduate. Priorities were based on economics, the economic needs of the hospital, not the educational needs of the student. The training school had a threefold obligation: to the hospital, to the patients, and lastly, to the students. In 1883, there were 3 Ontario hospitals with training schools. Within the next 40 years, there were 100. all varying in standards of admission and training. Their original purpose of educating was lost as they became merely a supply of cheap labor. These conditions were a source of concern to many, who recognized that to improve standards of practice and to obtain respect and recognition, a different educational program was necessary. Numerous critical reports on nursing education highlighted the inadequacies of training and recommended independent nursing schools. These reports were untimely and had little impact. After the war, there was a growing interest in health promotion and disease prevention. When 2,000 nurses returned from overseas, they found their previous hospital training, with its focus on disease and illness, was not sound preparation for this developing field. In 1920, through the financial support of the Red Cross, a Department of Public Health Nursing was established in offices provided by the Faculty of Medicine at the University of Toronto. Previously, postgraduate study had only been available in the United States, and nurses who sought these programs often remained there. By the 1920s in Canada, basic hospital training could be supplemented with a one-year certificate course in public health, an advancement welcomed both by nurses and employers of nurses. Edith Kathleen Russell had a strong academic background and supervisory experience with the Toronto Department of Public Health. She was appointed the first Director of Public Health Nursing. Kathleen Russell. June 1923. I would like to submit the following report, summarizing the first 3 probationary years of the department. Enrollment has been very large for a new department. We have accepted 139 students. Unable to meet the entrance standards, many applicants had to be refused. All things considered, no city on the continent offers a better training course for the public health nurse. Our enrollment equals the combined number in the 4 other Canadian colleges offering a similar program. We are asked to give students in 1 year the training and general viewpoint which will enable them to adapt to any branch of public health nursing. The hospitals of the City of Toronto constitute the laboratories in which these students must receive their practical training. The difficulties of planning and controlling such work are evident. Demand for our graduates is greatly in excess of the supply. We should increase the number of our students, but we must not lower our standards. The Rockefeller Foundation learned of Miss Russell's new approach to nursing education and provided her with funds to study hospitals in the United States and Europe. She returned convinced that all nursing schools must be removed from hospital control and brought into the government's education system. Florence Emery, a colleague with whom Kathleen had been associated in the Toronto Department of Public Health, was appointed Associate Director of the Department of Nursing. Together, they worked to improve nursing education. During the 1926-27 session, the department moved to the School of Hygiene, a school known for its research and respected for its contributions to preventative medicine. The department offered an experimental program of 4 years. A foundation was laid in the humanities and sciences in the first year, followed by 2 years in the School of Nursing of Toronto General Hospital. The 4th year in the university completed the preparation in public health nursing. In 1930, the first 2 graduates received diplomas from the university and the hospital, but the arrangement failed to provide an integrated educational experience. The program consisted of 2 contrasting institutions, one devoted to education, the other to service. Miss Russell and Miss Emery found this lack of continuity, not only in content, but also in method and philosophy, most unsatisfactory. The department needed freedom to experiment, to develop, and to grow. The Depression in 1933 was an unlikely time to unveil a new approach to nursing education. With a new location, a new name, and an expanded purpose, the School of Nursing at 7 Queen's Park opened its doors, the only school of its kind in Canada. No other Canadian nursing school had complete economic and administrative freedom. The result was independence, with the financial assistance of the Rockefeller Foundation. Kathleen Russell. With your permission, I will read from the first annual report of the new School of Nursing. We have in our school, in this new 3-year course, an experiment, which is attracting much attention, for a reason that is very simple, but profoundly disturbing in its novelty. Namely, that the student nurse is here merely as a student. She is quite independent of the hospital, as she is paying the cost of both her living and tuition. So her time belongs to herself and not to the hospital. This is all new work, educational research, and the situation is as full of problems as it is of possibilities. In 5 years, the school obtained permanent status with continued financial support from the Rockefeller Foundation. The school had grown rapidly. It now offered an undergraduate program in public health, general nursing certificate courses, refresher courses for graduate nurses, introductory studies of public health for occasional students, including pupils of Toronto's hospital schools. But the demand for graduates and new courses had also increased. War again made its demands on nursing society. The school was pressured, serving war needs as well as planning for post-war reconstruction. Regular courses were expanded as young nurses prepared to replace those serving in military positions. Refresher courses were requested to make full possible use of all available nursing service. Throughout, Miss Russell refused to sacrifice the school's independence and academic standards while maintaining a methodical development of the school. In 1942, the University Senate established the degree Bachelor of Science of Nursing, an event which acknowledged the intellectual component of nursing. Known as the Integrated Basic Program, humanities and sciences were combined with specialized education in nursing. Toronto's was the only school of its kind in Canada to offer an undergraduate degree where authority resided with the university, a school that was fully independent and self-regulatory. The school's tradition of innovation had brought it worldwide recognition. National and international associations provided bursaries and fellowships, allowing candidates to come to Toronto, the Mecca of nursing. Some came as observers, others came as students. With varied backgrounds and customs, they brought their knowledge and their experience. They returned home having grown in understanding and wisdom, prepared to give nursing leadership in their own countries. No division of the university had a better record of service to other nations than the School of Nursing. Nevertheless, during the next decade, nursing and nursing education was the focus of much publicity. Expansion of health services created extreme shortages of appropriately skilled nurses. Unmet demands promoted destructive criticism. Poor planning encouraged even more confusion and waste of nursing manpower. The school came under severe criticism for not developing short-term degree courses for graduates of hospital schools, as offered in many other Canadian and American schools. The school responded, but refused to be manipulated. Long-range planning was essential to continued progress. In 1952, A 3-year degree program was offered to graduates of diploma schools. Despite the prevailing chaos of the time, the schools celebrated the opening of the new School of Nursing, located at 50 St. George Street, a long-awaited occasion. Research was fundamental to the founding philosophies and continued to guide the evolution from Department of Public Health Nursing to the renamed Faculty of Nursing in 1972. From the pioneer work of the 20s and 30s to the controlled experimental work of the integrated basic program, the Faculty of Nursing remains a laboratory of educational research, determined to preserve the values of general education within a program where specialization is a necessity. Advances continue to increase the complexity of the healthcare system and influence the nature of nursing. It must be scientific as well as humanistic. The importance of having nurses prepared at the postgraduate level is increasingly evident. In 1970, the proposal for a master's program was accepted. Systematic investigation and research remain the guiding forces behind the development of the doctoral program. The Faculty of Nursing had a cautious beginning, at a time when nursing and nursing education were attempting to serve the 20th century with outdated methods. This history was characterized by increasing responsibilities, handicapped by inadequate resources. It was also a history guided with intelligence, wisdom, and enthusiasm by its founder and architect, Kathleen Russell. From 1920 until her retirement in 1952, Miss Russell challenged the obstacles of tradition to gain acceptance for the application of sound educational principles to nursing. Her commitment to developing, extending, and transmitting nursing knowledge never overshadowed her strong-felt responsibility to create a rich, educational experience for students. This experience prepared nurses with not only a professional philosophy of nursing, but also a personal philosophy of life. This commitment was shared by her colleagues and successors, who continue to build on foundations of a rich professional heritage. Radical innovations, ongoing research, and an influential, respected alumni continue to extend the reputation of the Faculty of Nursing around the world. From its roots as a meager department to a well-established and respected faculty, the University of Toronto has maintained standards of excellence and shown leadership in the nursing community around the world.